Kia ora. My name is Payal. Here I'm going to do a brief presentation on nicotine in youth. This presentation will cover the important aspects of nicotine addiction among youth in New Zealand, along with its correlation with associated mental health problems. Furthermore, I will touch base on how nicotine addiction affects the individual, family, and the community, relating to my 4 chosen Te Whiki tentacles: Te taha tinana, Te taha wairuatanga, Te taha whatumanawa, and Te taha whānau. Lastly, I will enumerate factors contributing to nicotine addiction in youth, along with strategies and appraisals to prevent nicotine addiction. Let's start with what is nicotine. Nicotine is a chemical compound that is present in tobacco. When tobacco is smoked, nicotine is absorbed through the wall lining of small air sacs present in the lungs. When sniffed or chewed, it is absorbed through the mucous membrane of the nose or mouth. Regardless of how nicotine is absorbed, it enters the bloodstream, where it circulates throughout the body and travels to the brain, where it binds to the receptor called cholinergic receptors. And thus, this leads to increase in the production of dopamine in brain, which stimulates emotions and promotes sensation of pleasure. Moreover, nicotine causes body to release epinephrine hormone, also called as flight and fight hormone, as it activates the sympathetic nervous system. Further to common forms of nicotine delivery: cigarettes, cigars, chewing tobacco, snuff, and electronic nicotine delivery system, which is vape. Now let's look at nicotine addiction and coexisting mental health problems. People with coexisting mental health problems such as anxiety, depression, and schizophrenia have much higher rates of nicotine use. Youth suffering from depression are twice more addicted to nicotine as compared to youth without depression. I'm going to discuss nicotine addiction among youth in relation to my 4 chosen tentacles. First is Te taha tinana, which is physical well-being. When an individual is exposed to nicotine, as I explained earlier, production of dopamine stimulates emotions and promotes sensation of pleasure. Dopamine also stimulates the adrenal glands in the body, which results in the release of adrenaline, and an immediate release of glucose causes tachycardia, tachypnea, and hypertension. Thus, nicotine serves both as sedative and a stimulant. Nicotine also stimulates pancreas to produce less insulin, causes hyperglycemia. Second dimension is Te whatumanawa, which is the emotional dimension. Youth faces some extra challenges during their adult years. For instance, change of schools, social circles, as well as worries about choosing a future path beyond school. As a result, youth faces peer pressure, which increases chances of getting addicted to nicotine in order to cope and feel relaxed. Individuals consume nicotine when happy, sad, or tired, or for something to do when bored. Moreover, individuals might consume nicotine to cope with uncomfortable feelings too, such as anger and nervousness. Thus, feelings play an important role during youth period. The third dimension is Te taha wairua, which is the spiritual health. Despite of numerous physical damage caused by nicotine addiction, it affects spiritual well-being of an individual. Youth gets influenced by misconceptions of nicotine effects, such as believing that they can make good decisions, helps to cope with their stress better, and weight loss. Thus, experimental light smoking habit rapidly escalates into heavy smoking. And lastly, the fourth tentacle, which is Te taha whānau, the family. Close relationship with parents is one of the most important factors contributing to good health and well-being of young people. Therefore, if an individual is a smoker, they are more likely to end up living with a smoker, and so as their offsprings are more likely to grow up being smokers. Now moving forward to factors contributing to nicotine addiction in youth. Youth can purchase nicotine online very easily nowadays by clicking on the age verification tab. Second is marketing. Although direct advertising of nicotine is banned, however, positive images of cigarettes shown in entertainment industry and social media attracts youth towards nicotine or smoking behavior. Third is fear of losing friends. Moving further to mental health and nicotine addiction services in New Zealand. We have Quitline, which is for smoking cessation, Sparks, which is for mental health service for youth in New Zealand, and the Tipuara Stop Smoking Service. And all of these free services are for New Zealanders. Interventions. Family-based intervention. It is focused on helping family identify their strengths and uniqueness in order to promote smoking cessation among parents and siblings. It also focuses on enhancing interpersonal communication among family members and household smoking bans. School-based intervention. This program focuses on developing social competence. Lastly, I have appraisals. Implementing the 6 A's in practice. Healthcare providers must screen for use of tobacco and nicotine by using simple 6-step approach called 6 A's in order to guide clinician counseling about smoking cessation. Anticipate, ask, advise, assess, assist, and arrange. The second appraisal is foster resistance to smoking among young people. The health provider must give clear messages to youth describing the established health risk and immediate effects of nicotine addiction and not emphasizing on the long-term consequences of nicotine addiction. Also, educating youth the potential of rapid development of nicotine dependence and that there is no safe level of nicotine consumption. Lastly, it is important to make youth aware of media, peer influences, and encouraging to follow REAL protocol, which is REAL, refuse, explain, avoid, and leave. Moreover, coexisting mental health issue, surrounding environment, and peer pressure in particular is a major provocative factor for nicotine use among youth. And adequate attention must be paid on youth to prevent nicotine addiction at that early age and provide effective counseling by using strength-based nursing approach and work in partnership with youth in order to reduce nicotine addiction. Thank you. Thank you for listening.